Hello friends, today we will discuss about the anatomy of the heart, that means structure of the heart. As we have discussed earlier that heart is a cone shaped hollow muscular organ and it lies in the thoracic cavity. Heart को अगर हम generally देखें तो its shape is like a cone. Its upper, this portion is called base and the lower portion is called apex. Its length is about 11 centimeter and it is slightly heavier in males as compared to in females. तो heart हमारा कहाँ पे lie करता है? In the thoracic cavity, and its upper part is called base and the lower part is called apex. So आज हम डिस्कस करेंगे what is the structure of the heart. The heart lies in the thoracic cavity slightly more towards the left side as compared to the right side, and the special space which is for the location of the heart, that space name is mediastinum. It lies in between the lungs. So this is the I am going to start the draw the structure of the heart. This is the septum, which divide the heart into right and left side. This portion is the right side of the heart and this portion is the left side of the heart, and there are 4 chambers of the heart. Each side is divided again by atrioventricular valves in the upper and lower segment. The upper right side is called right atrium and the lower side is called right ventricle. In the left side there is left atrium and left ventricle. We can write the full spellings: right atrium and right ventricle. Same in the left side. This is the left atrium and this is the left ventricle. There are 4 chambers in the heart and the sides are divided by this septum, and each side is again divided by atrioventricular valve. These are the atrioventricular valves. Atrioventricular valve. This is towards right side and this is the left atrioventricular valve. The right sided atrioventricular valve having 3 cusps, so that's why it is called tricuspid valve, and the left atrioventricular valve having 2 cusps, that's why this is called mitral valve. The second name of this is mitral valve and the second name of this is tricuspid valve, or commonly we can say atrioventricular valve right side, and which is left side, that is called left atrioventricular valve. The second name of right side valve is tricuspid valve because it has 3 cusps, and the second name of left atrioventricular valve is mitral valves because it has 2 cusps. So this is about the 4 chambers. How the 4 chambers are formed. Firstly, the heart is divided into right and left side with the help of this septum. Again, the right side divided into upper and lower segment with the help of atrioventricular valves. Then what are the other structures which are present in the right side and in the left side? So firstly we will discuss about the right side. In the right side there is superior vena cava, and the lower part is called inferior vena cava. In the right side there is superior vena cava and inferior vena cava, which collect the deoxygenated blood from the upper part and lower part of the body and drain into the right atrium. Its opening is into the right atrium because its function is to collect the deoxygenated blood from the upper and lower segment of the body and drain into the right atrium. Then one more thing, from the right ventricle, from the right side pulmonary artery Originate, which takes deoxygenated blood towards the lungs. This is called pulmonary artery. This is the pulmonary artery which carries deoxygenated blood from the right ventricle towards the right and left lungs. It is divided into right side and left side and carries deoxygenated blood to the right and left lung for purification. Its opening is controlled by valves, that is called pulmonary valve. In the left side there is the aorta originate, which carries oxygenated blood to the whole body organs. This structure which originates from the left ventricle and carries oxygenated blood to the whole body parts, this is called aorta. Its opening is controlled by the aortic valve. There are different segments, different names of the aorta. The portion which lies towards the upper side, that is called ascending aorta. This curved portion is called arc of aorta. And this portion which lies at the back side of the heart and moves downward, that is called descending aorta. Descending aorta supply oxygenated blood to the lower organs of the body, and to the upper organs of the body there are branches which originate from the arc of aorta. There is brachiocephalic artery, common carotid artery, subclavian artery. These are three arteries which supply oxygenated blood to towards the upper segment of the upper parts of the body, like brain and upper arms, upper limbs. So this is about the anatomical structure of the heart. Again we can revise. The heart is a cone-shaped hollow muscular organ which lies in the thoracic cavity, and its upper part is called base and lower part is called apex. The heart is divided into right and left side with the help of segment. With the help of this segment, this is called septum. Again the right side divided into upper and lower chambers with the help of atrioventricular valves. Then there are 4 chambers of the heart: right atrium, right ventricle, left atrium and left ventricle. And the valve's name is right atrioventricular valve, which is also called tricuspid valve, and there is left atrioventricular valve, which is also called mitral valve. And other structures which are present in the right side, there is superior vena cava and inferior vena cava. And function of these two is to collect the deoxygenated blood from the upper segment of the body and from the lower segment of the body and drain into the right atrium. Then from the right ventricle there is origin of pulmonary artery which carry deoxygenated blood from the right ventricle and transport to the lungs. This pulmonary artery again divided into right pulmonary artery and left pulmonary artery, which carries deoxygenated blood to the right lung and left lung for the purification purpose. Then after purification, blood comes into the left side of the heart with the help of these pulmonary veins. There is opening of 4 pulmonary veins. 2 collect oxygenated blood from the right lung and 2 pulmonary veins collect oxygenated blood from the left lung and 4 drain blood into the left atrium. So this will comes into the physiology of cardiac circulation. This we will discuss later on. These 4 pulmonary veins carry oxygenated blood from the lungs and drain into the left side of the heart, mainly in the left atrium. So in the left side there is aorta, which originates from the left ventricle and transport oxygenated blood to the whole body organs. The descending aorta supply oxygenated blood to the lower body organs, and there are different branches which comes from the arc of aorta, like brachiocephalic artery, common carotid artery and subclavian artery, which transport oxygenated blood to the upper segment of the body. So this is all about the structure of human heart. Thank you.